Good morning, ladies and gentlemen, and welcome to this Deka webinar on techniques and tricks to use when working CO2 laser. As said, the official language for both presentation and question will be English. You might send your question by acting on the question function arrow located on the screen you've been using to load to this webinar. All the questions will be answered at the end of the webinar and in the following day. All of them will be taken care by Professor Paolo Bonan, our speaker. For technical and logistic questions, Deka will provide detail directly. This webinar will be led by Professor Paolo Bonan, dermatologist, ESLD key officer, EADV Laser Task Force member, adjunct professor of Laser at Plastic Surgery University of Siena, and in charge of Laser Cutaneous Cosmetic and Plastic Surgery Unit at Villa Donatello Clinic, Florence, Italy. It's with pleasure that I then pass the word on to Professor Bonan for the beginning of the webinar.
Thank you, Simone, and good afternoon, everyone, or good morning, or good evening to those participants who live in other time zones. Before going into the agenda, I'd like to express my gratitude to staff at Deka, but also I'd like to thank the scientific director, Dr. Giustino Gallo, the area managers, friends, collaborators, in particular Irene Bini and Joanna Norgren, and all the friends that work in Deka. Thanks to all of you, this webinar was made possible. Before even going into the core of this webinar, I wish to urge you all attendees to actively participate to the webinar with a question, comment, thoughts that you can write down, you can note down, and we'll register with the chat, and we'll answer at the end of the webinar. In today's agenda, Deka CO2 laser platform will be outlined. This is one of the studies that we performed where we reported the experience gained over 3 decades of this laser. And we report even the technical developments of this particular platform that has reached an elevated degree of accuracy thanks to Deka's ongoing and relentless effort to improve its instrument and line of products and equipments, but also thanks to the constant feedback that we receive from you, fellow physicians, in our courses during Deka Academy in Italy and in other countries in the world. We and our patients share a common goal, that is the improvement of some cutaneous conditions and rejuvenation of photoaging and chronoaging disorders by exploiting the capability of the CO2 laser to be absorbed by water, that is the chromophore of this laser. For attain and pursuing this goal, we need to be always and share and exploit the particular features of this platform that are represented by the characteristics that you are seeing in this slide. The use of the fractional photothermolysis, Deka laser radius features, CO2 laser operating parameters, CO2 laser applications, and of course, question and answer in the sharing that we do normally in our courses. So thanks even to all of you for sharing with us your experience, your parameters, and your protocols. Fractional photothermolysis is a treatment that allows to obtain remarkable results with minimal downtime. We know this because we spare tissue for faster healing process. We exploit the thin and spaced column of thermal damage. We have a microablating effect and thermal effect in the tissue. We have three main parameters that we have to consider: the power, the pulse duration with its shape that is unique with Deka product, with the Smartxide. And we don't find in the market different pulse shape. And the third, the dot spacing between the column of light. With this, we can get quicker dermis and epidermis regeneration with reduced downtime. In this slide, you can see a skin histological examination after the treatment. You see the crater that we created with the fractional. And after 3-4 days, there is a dramatic increase of mitosis of the suprabasal keratinocytes, quite similar to the psoriasis. Accelerated turnover, very important to get a perfect wound healing. In this basin that is represented by the traditional historical Smartxide dot, we can see inside the other models that we have. So the Smartxide square, Smartxide touch, and Smartxide punto or tetra in United States. Another important features of this platform is the pulse shape design. This is very, very important because we can choose between these different pulse shapes. And with this pulse shape, we have different waveforms of the ablation areas, different lateral thermal damage distribution, different ablation profiles, as we'll see later on in the pictures. This is a corresponding ex vivo histological samples where you can see the different pulses: D pulse, S pulse, H pulse. Why we use the three pulses? In the first, the so-called SP pulse, we have the capability to go into the superficial layers of the skin. You can treat this part of the tissue. With the D pulse, we can go deeper with the ablation crater and the thermal diffusion capability. And with the HP pulse, we get a really cold ablation capability that we exploit with a freehand and even with a fractional scanner, as you will appreciate in the following slides. Another important feature is the smart stack function. Smart stack function is the capability to drill the skin like a hammer and getting the penetration depth and the ablation of the skin, maintaining the preset thermal diffusion by using the pulse duration. You see the comparison between stack 1 and stack 5. We can get the same total energy, in this case 30 millijoule, but reducing the erythema of the skin, but getting the same results. So it's a safer modality to have the results. This the comparison between stack 1 and stack 5. You see the great capability to go into the depth. So smart stack can be used to tailor erythema on the patient. Another important feature is the delivery mode: normal, interlaced, and smart track. For 90% of the cases that I use, where I use the scanner, is I adopt the normal. Sometimes to be cold in the treatment, I use smart track. That is like a sort of randomized modality to deliver the energy. And there is an innovative mode, that is the spray mode, that is present in punto and tetra. Sì, però, okay. You see here, randomized capability to deliver the dots in the scan. You see, we can do this with punto and tetra. 4 models. Smartxide dot, historical. The previous one was fantastic at the very beginning, and then the innovations, Smartxide 2, touch, and punto or tetra in United States version. Which kind of hand pieces we can use with this platform? The freehand with 7-inch and 1 inches that we'll see later on, and the fractional scanner. And even the action on the scan, we can have a vaporization, the incision, and stimulation, the fractional scanner. With the freehand operated parameters, we can have you can pay attention to the power, pulse shape, frequency expressed in hertz, and emission. We can do this with all the models and platform. In this slide, you can see a list of indications that we can vaporize with good clinical results and reduce this of bad scarring with the innovative protocols that we prepare over the last decade. And at a glance, the part of the clinical cases that we treat. This is a very important images because give us the opportunity to evaluate even what we have to do during the procedure. So looking at the layers, the ablation crater in 1 point, carbonization, coagulation, and hyperthermia. Why we have to pay attention to this? Because during the treatment, it's very important to remove the necrotic debris. Each session is passed because otherwise we risk to amplify the thermal diffusion in the surrounding areas. You have to remove the necrotic debris, as you can see in one of the videos that we presented. Well, CO2 traditional surgical handpiece allow us to vaporize, and you can see the results after 1 month. The same detail for pigmentation. You can note down even the parameters that we can have with the new model, Smartxide 2, touch, punto, and tetra. We use freehand mode with a 7-inch, of course, the largest spot size that allow us to vaporize the lesion. We can use the HP or SP pulse and the power around 1 watts with a frequency of 20 hertz. With the previous one, Smartxide dot, we use freehand modes with SP pulse level 2 at frequency 20. This is a comparison of the old and the new ones. This is a video. You can see here the skin that is not terrible with the sun damage, but we have some actinic keratosis and the capability to vaporize in the very superficial way by using SP pulse. We vaporize and we pass 1 time, then we remove the necrotic debris with the wet gauzes, what is very important. You see the capability to cover an area where we can see some discoloration with some damage, some hypochromia, and is not so terrible, but it's definitely sun damage skin. In this case, we have a thick seborrheic keratosis. We use EMLA. Normally, we apply the EMLA with the freehand and with the fractional scanner 1 hour before, and the topical anesthetic start taking effect in 10 minutes, and we can apply in the second time after 30 minutes, and we can and we'll see that the skin will feel that the skin will get number and number as the time goes on, and so we can treat even this thick lesion with a very low sensitivity from the patient. In this case, we treated this superficial linear verrucous nevus, and in the past, when we didn't have this kind of technology, we got not so good scarring. Now we obtain good results in terms of wound healing, you see, you can note down, in this case, the parameters, SP pulse level 1.5 and 10 Hz with the previous Smartxide dot, and freehand mode, HP pulse, power 0.7 and frequency 10 Hz with the new systems. This is a meaningful case where we can appreciate the treatment of sebaceous nevus, that is where we have a sebaceous nevus that is like a plug that interfere with the hair regrowth. But after the treatment, we have the completely and dramatic hair regrowth. That means that we are working with a very delicate manner in not teaching and not hitting the vertical follicle, but only the lesion in the skin. You see the parameters that we use with the new system: HP mode, power 1, and 50 Hz of frequency. Well, this is a huge lesion that we treat in 2 different modalities. This huge rhinophyma has been treated in operating room, in the surgical theater, in general sedation, and we took more than 3 hours because we have to remodel the nose to get the original silhouette of the nose. What is interesting, that is the front view, side view, and the bottom view. We can appreciate the total restoring of the texture and even the capability to better breathe from the patient, because we can vaporize at the best by using these parameters. First, we treat with a vascular laser, could be pulse dye laser with this kind of parameters, 6.5 joule per square centimeter and 0.5 milliseconds as the pulse duration, or Nd:YAG, fluence 100 joule per square centimeter, 2 subpulses, the first 5 milliseconds, the second 17 milliseconds with a delay of 17 milliseconds. The spot is 5 millimeter. After 1 month, we can have a second phase that is represented by the surgical treatment. You see the parameters: freehand mode SP pulse, level 3 with the previous Smartxide dot, and with the new, we have SP pulse, but 2 watt and 80 Hz as a frequency. It's very interesting because we have done a lot of mistakes in 90s when we didn't have this kind of possibility, technical improvement. So at that time we have best scarring, white scarring, not so good like we can have right now. This is another case, very interesting, that we got in the past, is the rhinophyma in women, very rare. So we treated with the pulse dye laser before, and then we treated with a CO2. And you see another case, fibroangioma, we treated first with pulse dye and second phase with the CO2. Perfect restoration of the texture. Dermal nevus of eyebrows. We treat these dermal nevus in 1 session with a freehand and SP pulse, and we got good results and hair regrowth. In the lateral of the wing of the nose, we have the complete vaporization of the dermal nevus, and 20 days, 1 month, you see the results. The nerval nevus of the middle of the cheek, very, very delicate area, because we are in the middle, is evident. So we use these parameters with the new one, freehand mode HP, 0.8 watt as a power and 20 Hz as a frequency. In the previous, we use SP pulse and 1.5 level and 50 Hz as frequency. Well, this is a video very representative, because apparently it's not so, it's easy, but not so easy, because it's on the line of the wings, and we start to vaporize the top of the dermal nevus, then we reduce the thickness. What is important is to know how we have to carry on with the procedure after the first pass. It's important to remove with the wet gauzes, and so that you can focus our selected action on the skin, and we finish to vaporize the dermal nevus. You can see in the side view the perfect restoration of the skin. It's very important even to understand the end point. Is one of the most important problem when to stop our procedure. And if you note in the lateral side, in the lateral view, side view, you can see that you have a very modest depression of the skin that you can see here. Uh, we have to get this result, this endpoint. We cover sometimes with a sort of hydrocolloid dressing. Seborrheic keratosis, but in particular areas, very delicate. The cartilago is very delicate, so we must contain the heating in the skin, not transmit this heating in the deeper tissues like cartilago, and we can vaporize with the results after 1 month. Another case and the parameters. You can see on the left, SP mode 2.0, frequency 20 Hertz, and level 1.5 with the previous Smartxide dot. On the right, the parameters with the HP or SP pulse and power 0.8 and frequency 20 Hertz. Please note down, write down these parameters because they are very important with the freehand. Well, carry on with our cases. Xanthelasmas. We treat very often this kind of lesion. Please appreciate how we can get a results with the maintaining even in inner canthus of the eyelid, the texture, the laxity of the skin without any best scarring. And there is another results with the parameters on the left and on the right. On the left with the Smartxide dot, we start with the 2.5 and then we finish with the level 1. We start with the 20 Hertz, we finish at 10 Hertz. With the new platform, we use normally we start with HP pulse and we finish with S pulse, but using 1 watt and frequency at 20 Hertz. Well, we have here another video that is recommended to observe with attention because we can appreciate not only the passes that we use, the safety measurements that we use for adopting the corneal shields, the metal cells corneal shields, and thank you. And you see the vaporization of the xanthelasmas that you start from the peripheral part, then to go into the center. You can even coagulate the vessel in the hole where we enter with the intralesional anesthesia. And then we can carry on with the vaporization of the xanthelasmas. And you can see the capability to vaporize delicately and gently. We pull gently the skin just to see, to evidence the entire lesion. At a certain point, we stop and we scratch with the wet gauzes, and we carry on to treat and vaporize the yellow tissue in the middle of the lesion. After this, we get a sort of strawberry appearance of the remaining lesion that is considered the end point of this vaporization. It's very important to know this because we don't know when we have to stop the vaporization. Vaporize delicately, but then after removing the necrotic debris, you can see this strawberry appearance. And then you can move circularly in the edges of the lesion. Well, now we have to continue with other consideration with the new Smartxide platform. We can do now the incision by using 1.5 inches, so the smaller spot size that allow us to use the handpiece like a knife, a diamond of light that allow us to treat a lot of indications and cutaneous conditions. On the left, you see from the abdominoplasty to through the blepharoplasty until the breast augmentation by cutting the periareolar area, and then just the treatment of the lipoma. Freehand operating parameters, we have to pay attention to the power, pass shape, frequency, and emission, as in the previous one at 7 inches. This picture is very significant because we can appreciate by using HP pulse, freehand mode, freehand handpiece, and 1.5 or 2 spot size, we can appreciate the sharp demarcation of the cutting area of the incision. This gives us the opportunity to operate in the clean theater without bleeding or with a minimal bleeding. This is another case where we combine different handpieces. It is the advantage of the platform. So we can move from one to the other handpiece, from the freehand handpiece 1.5 inch for cutting to the 7 freehand handpiece for vaporizing some lesions that are present in the eyelid, to the scanner for the fractionated treatment of the eyelids. So in the upper eyelids, we have a laser blepharoplasty for the incision, and then we have lower transcutaneous blepharoplastic, following by fractional blepharotightening with the scanner. But this video is very important because show us is our stuff, and then the operating room. The pre-operative procedure is the same that the traditional with the knife. Then we can use for the upper blepharo the local anesthesia, and then you can cut the marker that you have done with the marker. You see the perfect incision and the modest bleeding that we have. After this, we can remove the lozenge that we get after this incision, and it's important to evaluate how is delicate this incision. It's important even in terms of the type of scarring that we get. We don't see any sign at the end after 20 days, or even 1 month, or even 1 year. We put the stitches as usual. So we can see this kind of procedure, but we can adopt any kind of stitches application. Then we perform the transconjunctival blepharoplasty. We can use intralesional anesthesia, or you can use a local regional anesthesia, and you have to pull out the fat after the incision of the conjunctiva. Of course, you have to be skilled to know perfectly the anatomy of the area, so the nerves and the vessels that we have in this part. You pull out all the fat, you coagulate the fat, you clamp sometimes some vessels that are open, and at the end, you use the fractional scanner by pulling down the skin a little bit, because normally when we remove the fat, we leave an empty area, and so as a consequence, we have a laxity of the skin. So for that reason, we finish the treatment with the fractional scanner. This video is very significant because we can see how sometimes we need to be very precise by pinching the skin and obtain a cleavage from the orbicular muscle. Please look at how we hold the handpiece. at 45-degree angle. This is very important. How we move, how we hold the handpiece. We are talking about tips and tricks. Is one of the most important tip and tricks that we can do. Please hold the end pieces in this way. On the other side, the opposite angle we can use. Exactly. Well, of course, we can manage the entire treatment of the orbital areas. Of course, we can treat even the so-called dark circle that is often seen, especially in South America and Middle East, and even in Far East. So we can treat dark circle with the fractional CO2, and we get very good results. Of course, we can use blepharoplasty and other procedure in the periorbital area. Stimulation, we can perform with the scanner emitting the fractional scanner. And so the main application of fractional CO2 laser are rejuvenation, treatment of scars with atrophic, hypertrophic, keloids, and disfiguring scars, and actinic keratosis and cancer, no melanoma cancer, of course. This is at a glance the good clinical results that we can have with this indication, the clinical indication. Why? Because we biostimulate the skin with a fractional. In this slide, I'm really proud, and I really want to thank my staff for getting these results. We won 4 trophies in 4 editions of AMWC Congress. What is important that we won the trophy by using fractional CO2 in each of these cases that you see here. The first, depression after injection or corticosteroids and the atrophy. The second, the scars. The third, face syndrome that you will see later on, and the scars in the self-inflicted lesion. The fractionated is characterized by microablative skin remodeling and a lot of column of light. And you see here the dot that are the roof of the column of light that penetrate into the depth depending on the parameters you use. And you see here a lot of parameters: spot size, spacing, cooling, pitch means fractional, dual time, spray mode in the punto and tetra, stack, pulse shape, and radio frequency. Focusing on the pulse shape, you have to take in mind that we have 3 main parameters. The first 2, we have power stacking, are strictly related to ablation capability. The third, dual time, is related to the thermal diffusion. But there is a 4th parameter, the pulse shape, and in particular DP, that we use in the 90% of cases of fractional treatment, that allow us to go into the depth and stimulate into the depth and microablate in the deeper layer. You see the pulse shape design and the pulse modes, the great capability to go into the depth and the ablation crater, very, very deep. Well, we publish a lot over the past decade, but I want to focus our attention in these 2 studies where it's evident that after the treatment, the 2 main cytokines, BFGF and TGF beta 1, that are balanced in the wound healing, are moved only and above all with the lower parameters at third days and 30th days. You see, there is a movement only with the lower parameters. What does it mean? That when we use the fractional scanner, we have to use not the stronger parameters, but the proper combination of parameters in the right way, in the protocol that we get normally in our experience and we share with you now, but even in Deka Academy that we have done up to now. There is a very innovative procedure that is called cool peel. The cool peel can be done with the spray mode, especially with the spray mode that we have in Smartxide Punto and Tetra, that allows for consecutive scans to be delivered very quickly and with random borders, so as to reduce emphasis on skipped on overlapped area, so we can avoid demarcation line. So it's a great technical advance of this platform. We have different levels of can be soft or not so, or less soft, softless in the usage. You see now the cool peeling. You have a pseudo random scanning, and the cool peel allow us to treat very superficially the skin. We are using HP mode. HP mode is the cold mode, you know, and we use in particular in the cool peel. The cool peel lead to these results thanks to the Dr. Carinis that give us the opportunity to compare our results with their results, and we get the same results as you can see here in this picture. What is interesting is that after the treatment, this is our patient, we have it's not dramatic, but we have it's definitely some damage skin, where we have some dyschromia here, we have some vertical lines, some crepey skin, and hyperpigmentations, and some laxity. Our cool peel that we can adopt even with Smartxide Square and touch, of course, by using HP Pulse and Stack 1, you have to take in mind this. We can have a very not so aggressive treatment, but the results lead us to this very interesting lighter skin. And sometimes if you go here, you can see even in this area, in the marionette lines, in the smile lines, animation lines are reduced, and even in the jaw area, there is a modest tightening. The texture is completely removed, that is completely improved and remove the old skin after this procedure. And what is interesting after this procedure is that the recovery time is pretty smooth, and we move very rapidly to the into the new skin. Going back to not to the cooling, and but the so-called cool peel, but using the fractional by using the DP mode in 90% of the cases, we can get a tightening of the skin, a very firming skin, even in the neck, very delicate area. You see the seborrheic keratosis indicates that we are in the same point after the procedure, 7 months out the treatment, completely restoring the skin. Even another case. Well, you see the parameters. With the new platform, we have completely tightening of the skin with the DP pulse, power 8, approximately around 8, dual time 600 microseconds, dose spacing 1000 micron, and stack 2. With the old one, the traditional Smartxide dot, we got the results with SP Pulse, power around 14 watts, dual time 600 microseconds, and dot spacing 500, stack 2. The stack 2 even with the previous platform. Sometimes we can combine 3 modalities: fractional CO2, radio frequency simultaneously emitted with the laser, and laser lipolysis, characterized by the injection of local anesthesia and then the use of fiber 300 micron and Nd:YAG with one of the product of Deka, that is Smart Lipo. You see the results. The blue line indicates the original position of the laxity of the skin, and then after the treatment, after the procedure, 3 or 4 months out the treatment. Of course, in this case, the platysma must be not laxed, not relaxed. Going back to the fractional CO2 in the treatment of the upper lip, we have the tightening of the skin. We remodel the silhouette of the lips. We still see after 1 month some pixel image in the upper lip, but good results in terms of tightening. And this a passion through the entire process of the session. 1 session, 2 session, third session, sorry, there is a mistake, and fourth session. You see the progressive smooth area, firm skin. So fantastic results in terms of tightening. And we have these results, the same results that we got with the prior traditional resurfacing laser, but which took several weeks or months in the recovery time. Now we can get the same results with a shorter recovery time. I would say that we can get a peak redness around 24, 48 hours, but as seen maybe in this case, in the periorbital rejuvenation, we published in 2012 in JDV the fractional treatment of the eyelid, and you see the sequence of the event, of the appearance. Immediately after the treatment, immediately after the procedure, we have a peak swelling that is around 24 or 48 hours, and a peak redness around 24 to 72 hours, or sometimes 4 days, but rapidly taper off in new pink skin and firm skin. This is one of the cases that we published in a 40 years old female. We treated, and you see the treatment in the pre-operatively picture and immediately after, before and after. You see the tightening of the skin, and normally the recovery time is pretty smooth if you use the proper parameters, and you see the detail on one side and the other side. So dramatic tightening of the skin. You must consider that we are not using any incision in this case. Another case, we have non-symmetric upper eyelids before, and we treated only one eyelid with the results. So we lose the infolding and laxity of the skin. This is a magnification of the detail. Another case, with the closed eyes, the tightening of the skin. Acne scars. So acne scars is one of the favorite indication. They are good candidate to be treated with a fractional. This is a article that is in press in the Springer book, in one of the chapter of this important Springer publication. And it's important to evaluate the improvement of the skin, the atrophic scars. You know that we have different ice peak, box scar, rolling, and so on. In this picture, in this video, sorry, you can see the high scan dot plus radiofrequency in mild acne scars. You can see that we can treat the entire area where we can note a lot of depressed scar. What is important is to treat the patient with a laser in the cold situation, not when there is acne in the inflammation phase. Only in the post-acne scar we can use the treatment. Otherwise, we risk to have a flare-up, so the recurrence of the acne in the inflammation phase. We can treat the roller acne scars with the parameters. You see on the left, the new parameters with the new platform, DP pulse as usual, power 10, dual time 800 microseconds, dot spacing at 700 microns, stack 2, radio frequency 30 watts, and dual time 3 seconds. With the previous glorious Smartxide dot, we use SP Pulse, power 12 watts, 1000 microseconds, and dot spacing 500 microns, stack 2, as usual. These I speak acne scars and the results. I think it's very important. In terms of tips and tricks, I feel to recommend to you the use of the freehand and scanner in the same session, because we can have in our armamentarium a lot of strategies that you can see in this slide, but we prefer in our protocols to use the laser. How use the laser? This is one of the example when you use the freehand to vaporize the edge of the deeper acne scars, the deeper depressions, in particular the surrounding areas of the depression. Why is so important? Because we can combine the free hand, so the surgical modes for vaporizing, for ablating the edge, the wall of the atrophies, but then you can use the fractional in the same time. This is an example. You see on the right with the blue circle, the edge that has been that we treated with the vaporization mode and the freehand SP pulse. And on the left, in this point, we still see the fractional dots because we combine the two modalities in the same session. First fractional to stimulate, and we will see the results in 2 months, because you know that for getting new collagen from collagen type 1 to collagen type 3, new elastic fibers, and so on, we need more than 1 month. So we have to wait. In the meantime, we treat with the surgical laser the edge so that you can have a double action on the skin. That is very interesting as a tip, as a trick in the treatment of acne scars, but not only. This is the jellyfish atrophies. The scar is interesting to note how it's important to get this fractional laser and tight the skin in this area. Dopo, Simo. This is a synergy with the new technologies. Very often we combine fractional and pulse dye in many cases of scars, atrophies represented by stretch marks. This is very significant case where we have the stretch marks here, we treated, but we got even another effect. Of course, is an anecdotal case, but we have a sort of passes. It's not surgical passes, but it's important to see how we can tighten the skin, not only in terms of improvement of the stretch marks, but even the to have a very firm skin after the procedure. With the stretch marks, we get very good results. Not in terms that complete restoration of the normal skin, but in terms of narrowing the stretch marks so that the final results in terms of appearance is very, very nice, is very good, and the compliance of the patient is very high. This is an example where we have not only the improvement of the stretch marks, but even the increase in the tone of the skin. You can see here in the periumbilical area the results. These are the technique and the parameters. On the left, DP pulse, power 10, dual time 800, dot spacing 500, stack 3 or 2, depend of the type of skin. With the radio frequency, we use 30 watts and 3 seconds and as dual time. With the previous one, we use SP Pulse, power 12 watt, dual time 1000 microsecond, dot spacing 500 microns, sorry, and stack 2. This is one of the examples. You see, the idea here is to square line the to draw the square in the skin following the stretch marks. You can reduce a little bit even the percentage of the area of the square, and so that you can follow the stretch along the and in the entire area. This is a very interesting study that we are publishing in Journal of Cosmetic Dermatology, and is about the combination of the fractional CO2 laser with the microwaves. Microwaves that is one of the new products of Deka. The name is Onda. It's very promising. Is already a confirmation because we are using Onda last 3 years with very good results. In the case of postpartum abdominal laxity with a lot of stretch marks in the skin, we prefer to combine the two ones. You see here the 3D measurement with the quantifier is one of the modality that we have in our clinic. And you see the 3D, the capability to have a measurement of the gift and even the change in the volume that give us the opportunity to reduce stubborn fat and to evaluate the tightness of the skin. You see one of the case, reducing the fat and tight the skin. And here we have the results in this combination before and after. Onda plus Smartxide. Here we have another video where we show you how to deliver the energy on the fat before with Onda, and then after 1 month more or less we perform the treatment with the Smartxide 2 in this case, emitting laser and simultaneously radio frequency. You see, we have no or minimal overlapping. This is valid for any kind of treatment, even on the face resurfacing or any other parts of the body, the neck and décolleté. This is the procedure that is always the same. And then we continue to cover the entire area where we have the laxity and stretch marks. Well, you see one of the results. I put this slide just to show you the sign of the fork with the radio frequency that indicating that we use microwave, fractional, and radio frequency. And you see here the combination. Well, scars and keloids, they are very important issue. We treat very often combining the laser, the fractional laser, with other lasers, depending on the type of scars we have to treat. This is one of the cases where we are really proud to treat this patient. There are self-inflicted lesion with the following bed scarring, red scarring, sometimes with a very thick lesion, fibrotic lesion, before the treatment where we combining pulse dye laser, Vascu from Deka, and fractional CO2, Smartxide 2. And you see after the procedure, after the first procedure with the pulse dye laser, 1 month of interval apart, second treatment with the fractional CO2, and then the results. You see, we are really proud because the psychiatrists that follow the patient call us to thanks because we contribute to the balance, psychological balance of the patient. You see here the 3D images and the evaluation of the chromophore that is improved after the procedure with the pulse dye laser and fraction. Well, you see the parameters on the left, the scanner with the DP pulse, power 8, dual time 800 microseconds, and 500 as the dot spacing, stack 2. On the right, you see the 10 millimeter as end pieces, pulse duration 0.5 milliseconds, and fluence around 8 joule per square centimeter. Another case where we treated with a combination of pulse dye plus fractional CO2 was the cutting, the patient cut the skin with a knife, incidentally, of course, and we got the results at the end with a very, very good results. And this is the 3D images. Well, the parameters are the same. You see on the left, DP pulse, 10 watt, 800 microseconds as dual time, 700 microns, stack 3, 30 watts as radio frequency, and 3 seconds in dual time radio frequency. On the right, with the previous, we used scanner dot mode with SP pulse, power 12, dual time 1000, dot spacing 500 microns, and stack 2. Face syndrome is very meaningful. The name is Sylvia, and with face syndrome is considered one of the most common neurocutaneous vascular disorders in childhood. We used a lot of lasers in the improvement in the treatment of this girl, and with the several zetaplasty surgical treatment were also performed with using CO2 surgical and piece and high pulse mode with 1.5 inches. So we cut it several times, but you use mainly the fractional CO2 laser with other vascular laser, as you can see in this light. But at the end, we got these results. We went from a state of total hopelessness to restoring self-confidence and esteem, allowing the girl full social recognition. Another case, very interesting and significant, a severe case of extensive post-birth scar that we treated with a fractional CO2. So we restored not only the flexibility of the skin, it was at the very beginning was a very hard skin, but even the oval was improved and the appearance. So much we even use the fractional plus lipofilling is another procedure, another product that we adopt in this kind of clinical cases in the post-burning scar. And the leg that was not capable to stretch after the treatment was able to stretch. So more flexibility after the treatment, after the procedure. We are approximately 2 months out the treatment. In this case, we got even the possibility for the boy who has suffered severe burns to be on the catwalk. We are physicians, so we are really proud for this result, even from psychological point of view. The other application are the premalignancy in the sense of non-melanoma premalignancy. You see in the literature, we have a lot of studies in skin cancer, but just to show you what we can do. We can treat with the free hand the sun damaged lesions. You see some hyperchromia, some crappy skin. The skin is thinner than the normal, so it's not dramatic, but we have is definitely some damaged skin. So we treat with a free hand, but we can even treat with a fractional. We can treat with a fractional. The fractional CO2 is capable to renovate the skin even at the molecular level, because sometimes we treat with the fractional even décolleté and the face when we pass the fractional, normally with the purpose to improve the cosmetical appearance. We have even a sort of rejuvenation at the molecular level. So the number or the percentage of the basal cell carcinoma that we have in the skin, usually before the treatment, we don't see any recurrence after the fractional. So maybe we have even a sort of rejuvenation at molecular level. This is very interesting because it's one of the cases where we use a fractional plus pulse dye, but the fractional is used like a sort of adjuvant, a sort of helping laser to the pulse dye. It's well known that pulse dye laser is used and is is one of the tools that we use in the basal cell carcinomas. You see here two BCC. in the first treatment, we open the roof of the area so that we can use the pulse dye laser with a typical purpura, and you see the results after three months. This is one of the BCC that we treated. It's very important to highlight that we don't treat with the laser any kind of basal cell carcinomas. We have to select. We need the inclusion criteria that are the BCC must be less than 1 centimeter, 1 centimeter and a half. They are not ulcerative BCC. They must be in particular areas and that are not the eyelids, for example, or the scalp, and we have to vaporize the lesion. The lesion, if you know, you mark the area 0.5 centimeter, 1 centimeter out of the clinical evidence of the tumor. We vaporize the lesion until we get the endpoint. This is valid for especially young people that are around 50 or 60 years old, because they don't want to have any disfiguring scar at the end of the treatment. So we can get double goal. The first, if you be very effective. The second is to be conservative in the sense of the cosmetic results, because we and our passion have one common goal: to be precise, time effective, and above all, to ensure safety all the time. So with this kind of procedure, we can do all this uh, target, all this goal. You see, we need to remove the necrotic debris, as I already explained in the previous slides, until we get the final steps of this treatment. An important slide here. So in the pre-operative evaluation, treatment and post-op treatment. First of all, we have to consider that before the treatment, we start to use only the topical for reducing the number. And so we get number and number and number as the time goes on when we apply the topical. So we apply the topical 1 hour before. When we use the day of the treatment, the antivirus, normally acyclovir, we can use a cooling Zimmer together for reducing the pain sensation. And immediately after during the procedure, we have to remove scratching with the wet gauzes. And what is important to apply is high saline gauzes immediately after the immediately after the procedure, fractional or freehand. Then we use antibiotic cream in the first 4 or 5 days, and then it's very important to use any kind of moisturizers and regenerating cream. In the United States, they use Aquaphor. They can use thermal cream like Aven or the French company Aven or La Roche, or we can have even other cases where we can use, is on our choice, of course. I never use oral antibiotic unless we are treating very large, extensive surgical indication. In the case of acne scars, you have to stop any kind of isotretinoin treatment 1 month before the treatment. We must be very cold in the treatment, and the skin must present no inflammation when we treat with the fractional CO2 and with the freehand. Complications, mistakes, and side effects. One of the most common mistake is the herpes simplex. Normally, if there is a positive history in the anamnesis or herpes simplex, or when we are very aggressive with the fractional, we are eating a lot the skin, is like sunburning. So we need to prevent by giving antivirus drug for preventing this situation of this, where we have multifocal herpes simplex. This is one of the most common side effects, that unwanted effects that we get. Well, in conclusions, we have to consider parameters knowledge, biological tissue response awareness, and clinical treatment expertise. And I would say that Deka CO2 Smartxide is a significant breakthrough in the laser treatment of the skin, whether it's aging changes, hyperpigmentations, acne scars, any kind of dermatological lesions, and no melanoma, skin cancer, some selected skin cancer, and even wrinkles. This significant breakthrough allows us to treat the patient in the safety manner with a very good clinical results. And I think that this breakthrough has changed the way of physician to approach the skin treatment with the surgical laser. With this on the left, with this significant picture in these difficult days, in our days, that I really want to thank you for your attention. And I think we can move on to the question and answer session. Thank you for your attention.
Thank you, everyone. Thanks again to be so many to participate in the webinar. We've been receiving in the meantime a lot of questions, touching each of them on the topics that Professor Bonan was so clearly and exhaustively explaining to us throughout the entire course of the explanation. Most of these are actually about acne scars. Most of them are mostly about the parameters, and from the Far Eastern countries, many of them are requiring details about the management of PIH patients. Some of them we would like to give an answer to right now in this session of question and answer. It's surely how to manage the PIH in ethnic and Asian skin types.
Yeah. Before closing this session and answer to your comment, your thoughts, let me thanks warmly the scientific director again, Dr. Giustino Gallo, and of course the general director, Dr. Paolo Salvadeo, for making this webinar possible. Thank you very much, all the staff and the friends in LM. So we are waiting for the question and comments so we can answer.
So we might start exactly with this question, Professor Bonan. How can we manage the PIH in Asian skin type patient and ethnic skin type patients? The question is how to manage PIH in Asian skin type patients or ethnic skin type patients.
Thank you for the question. It's a very crucial question, and I think we have to pay attention not only in the Far East, in Asia, but even South America, in Middle East, in south of Italy, but of course, above all, in Asian skin, that we, during our treatments and our training there, we noticed this particular sensitivity to develop the PIH. And to prevent, we normally use particular tricks that are represented using fractional, to use HP mode the first feature, to enlarge the space of the dot, to reduce the power, to cool down the skin. This is the technical part. We use the DP mode or HM mode, depends of the type of the skin. This is a technical part of the laser. Then as a protocol, we apply immediately after the treatment the corticosteroids for 3-4 days. I prefer clobetasol, is one of my favorite in the candidates, that the candidate of PIH, even in the history of the patient. So we apply and we gently put not only moisturizers but even mixed corticosteroids for 4, sometimes 5 days, that stop immediately the melanocyte melanosome system to be active. And then sometimes we use some creams, discoloration creams and hydroquinone to prevent and to treat for 5-7 days post-op. So first corticosteroids in the first 4 days, then we apply hydroquinone and some cream with where in the composition we have hydroquinone 4% of dosage in the cream. This is our strategy to prevent and to treat the further PIH.
There's surely a very high interest for what it concerns the acne scar management at all levels. And some of the questions that we've been receiving are mostly concerned about the endpoint when we treat acne scars.
Yeah, the endpoint is in term of during the treatment is of course represented by the preset operating parameters that I suggested before. And of course, we cover the entire area with a minimal or no overlap of the square area with the fractional. In terms of freehand, the delicate action, gently action of the freehand by using HP pulse or as pulse sometimes, by vaporizing the edge is representing only one pass or 2 pass in the edges so that we can complete the strategy. In terms of the post-op evaluation, if you take you through the patient from the pre-operative preliminary interview to the results, I think that as the times goes on, the more treatment you do, the best will be the results. So normally the endpoint are on average 3-4 fractional treatment, of course depending of the severity of acne scars. In the deeper acne scars we need 4-5 sessions with 2 months of interval apart between the sessions.
Perfect. Can you also gives our audience some indication about the power selection criteria and how do you select different kind of conditions depending on the different access task?
In terms of parameters?
Yes, exactly. Many of our doctors assisting here the webinar, they want to know about the criteria of the power selection. So why we are choosing that predetermined power versus others?
Well, there is a range where I move my criteria, and normally the range, just to give you the possibility to move in a smooth modality, I move in the range of power that is between around 8 up to 20, up to 12, sorry, as a power, and depends of the deep layers that we have to get to penetrate, in the sense that if we have a deep acne scars, we use a 12 watt. If you have deep acne scars, we use a stack 3. If you have deep acne scars, you have to increase even the dual time up to 1000. If you have not more superficial acne scars, I would stay around at 8 watt, just around 500 um, as dual time and stack 2. So these are my parameters to give you just a trick, a tip in this kind of application. Depends of the clinical appearance of the patient and the severity of acne scars. But the range, to give you just a very narrow range of application, are these: 8, maximum 15 watts, 8, stack 2 or stack 3, and dual time from 500 microseconds up to 1000, sometimes 1200 microseconds.
Thank you, Professor. Another one. Do we combine air Zimmer during this kind of procedure, or do we uh, use some kind of smoke evacuator devices along with the laser?
Yeah, we use anytime a smoke evacuator, of course. We prefer always, especially in these times where we need to remove any particles of even potential particles of virus, but even smokes. But what we don't do always is to cool down with the Zimmer, because I think that we need to warm the skin to get the results. Only when we have the risk of PIH, we use the Zimmer during and after the procedure. We only use the ice sealing gauzes after the procedure. Well, uh, there is another evaluation that we have to do, I think. The how to move to give you some tricks to move with the patient. Please remember to hold the handpiece, especially the freehand, hold in the right way, because I've seen a lot of colleagues, as I did in the past, because I have to highlight that I have done a lot of mistakes. Now you see, as in the Congress, a brilliant cases that we presented today, but I have done a lot of mistakes in the past. I had a lot of bad scarring, a lot of PIH. Only now I can report back to you our skills, our tips, and our tricks. Please, all the NPs. Apparently, it's a very simple thing, but all the NPs in the right way.
That's good. Keeping on going, talking about these techniques. A few questions are relating the punch elevation where treating boxcar scars. Okay, so this kind of procedure that is actually done at the same time of the CO2, many of our users would like to know how what how was performed. So how was the punch elevation was performed?
Yes, I think that is a good technique that I don't adopt, but I know a lot of colleagues that do this, and I suggest to use the fractional CO2, waiting at least 20 days after the punch elevation, because we need a little time to before performing the fractional CO2 laser system. My suggestion is to wait 20 days, 1 month after the this kind of procedure. But it's good technique. I don't use because it's my choice, but it's very good.
There's a few questions instead pointing to the settings for tight scars. Can you share with us a few of those?
Which scar? Sorry,
Um, Tight, as these colleagues of yours is actually asking,
tight. You mean what?
probably very small ones.
Small, small scars?
I think so.
What do you mean? The the hypertrophic, keloids, small scar,
We are talking about the acne ones.
acne ones.
Yes.
Okay. About this, the small, I use the following parameters. We apply 8 watt, as I said, 8, 10 watts as a power. and the spacing is around 500 microns, dual time around 700, 800 microseconds, and stack 2. This is for the fractional. And I always use, with most part of cases, I combine the freehand during the session. First fractional, then the freehand, because I love to be a little bit surgical, not only stimulate the biological tissue to remodel the collagen fibers, elastic fibers, and even even the extracellular matrix.
That's good. Let's move out a little bit far from the specifically the acne scar and talk about the mold removal, especially for Far Eastern patients. There's always a risk of recurring and most of the times might be not killing procedure. In some kind of settings, most of the users are using zero point 0.5 watts and 5 hertz frequency. Is it a proper set of parameters according to your experience, or they might migrate to other values?
5 watts and 5 hertz
5 hertz, yes.
and point 5
0 0.5 watts and 5 hertz.
0.5. And
0.
which kind of pulse?
This is
SP or
not
HP?
specified actually. It's not specified in the question.
I think it's we must be safe, of course. With these parameters, they are pretty good. We can vaporize the edge of the depressed scar. Is pretty good because you are not so aggressive. You can vaporize like a painting you are doing, and so you can get a very smooth, a pretty smooth area. So yeah, this could be a good idea. Of course, if you are a little bit experienced, you can increase my suggestion to go up to 10 hertz because it's my favorite frequency in treating and vaporizing the edge of the acne scars. Of course, we are talking about the freehand, 7-inch, larger spot size.
Right, talking about the technique, there's another question coming from the south part of the America that is actually asking details about the choice in between HP and SP mode while vaporizing. So what's your criteria and how do you manage the possible bleeding that might be associated to each of the two pulse shapes? Or at least if you ever use in a Smartxide Square device the UP in any of the cases?
Well, thank you for the question. I very often combine the two types of pulses. In blepharocope, for example, I cut with HP and then I coagulate with SP. Why? Because as you said, have seen, the SP has a thermal tail that is responsible for the coagulation in the bleeding. So very often I combine. I use HP in term of vaporization with a 7-inch, so larger spot size, not for cutting. In the larger spot size, I use HP in the huge mass. For example, in rhinophyma or huge mass, the gland, I start with HP because we need a scalpel of light and not to heat the tissue so much. At a certain point, I switch on SP if you have a lot of bleeding because HP is too cold to coagulate. With SP, we have more chances to coagulate the vessel and bleeding.
Other questions? Um, if they're asking if you can give us a practical hint on the number of procedure that might be recommended for filling in post-acne and post-operative scars.
Sorry, because I lost the volume of the voice. Could you please repeat?
Absolutely, yes, sir. So they're asking about how many procedure might be recommended for filling in post-acne and post-operative scars?
Uh, I would say that just around 5 or 6, an average number of sessions.
That's good. In some of the country, they're saying they do need to perform histology after any single removing of skin formation. So, do you do any kind of histology before the vaporization of skin formation?
Yeah, I do in the case of treatment of basal cell, where we have a clear clinical diagnosis, but we prefer to shave the skin in the top and send to the histological examination. And this is one of the case, or some suspect lesions where we are not sure in the clinical diagnosis. So I prefer to perform. But in any case, if you at a certain point to use the laser as a treatment, you get approximately the same results because you must be a little bit uh, smart and skilled to perform first the biopsy. I prefer the shaving. So we have to treat on the top by using SP pulse for coagulating the bleeding that we have after the shaving. Then you can continue with the HP pulse. So you see, so it's a very nice to talk about the Smartxide Deka because only this platform allow us to move from one handpiece to the other. In the case of histological examination, for example, only this laser can allow us to uh, pass and to move from one handpiece to the other. There are no other tools in the market that allow us to do this. So even in this case is a really technical advance of Deka, thanks to Deka efforts and improvement of their line of equipments, and in particular, in Smartxide. There is a terrific technical developments even in this case, and in particular in this situation where we need to be very flexible from one to the other in piece by knowing and to for this reason we are doing now today the webinar, and we are carry on with the DEC Academy for increasing and improving the knowledge about how to use the CO2 and in particular the CO2 DECA machine.
That's good. Let's migrate a little bit more towards the blepharoplasty field now. So, are you using particularly intraocular shields during blepharoplasty, and are you using ocular anesthesia?
Yeah, we use Novozyme as anesthesia, the drops. Then we insert the metal sands, corner shells, because we have to move in a safety manner. So you remember that sharing the goal with the patient is to, above all, to ensure the safety all the time. And we insert the metal sand. You can find in the market. It's very easy. The size is changing depending of the size of the ocular part areas.
Another question is relating the parameters used in the blepharoplasty procedure. Concerning the Smartxide dot machine, do you have any recommendation, suggestion in using surgically the continuous wave in blepharoplasty?
Well, I think that is a very important question for whom as the traditional, historical, fantastic Smartxide dot, still fantastic. You have no particular features, but remain one of the best in the market, even the previous one. My suggestion is please don't to use continuous wave. Why? Because all the advantages that we can have with the laser can be lost. So it's very important to use SP pulse, not continuous. We must use the opportune power and frequency. in the sense that sometimes we use even 80 hertz as frequency. So it's very close to the continuous, but it's not continuous. And so allow us to get and to result in a good scarring, even with the dot. So please don't use continuous wave. Use 80 hertz as a frequency. So allow us to coagulate and cut. SP because you have only SP and not HP. That is a real advantage of the new platform. But you can cut. You have a good incision of the skin with SP, and power is normally around three. Around three depends of the thickness of the skin of the eyelid. Normally it's very thin. It's 0.04 millimeter in the eyelids, but can change on the basis of the skin of each patient. You have to customize the power, so the ablation capability to go into the depth.
Another question is actually relating to what kind of anesthetic product, anesthesia, do you use in dermatology surgery as well as in fractional treatments? And when you infiltrate a lesion, what kind of product you might recommend to use?
Well, there is a pharmacy that prepare for us a mix of lidocaine and other anesthetics. One is a short term and long term. They mix the two, and mepivacaine and many others. But one topical is still good is EMLA, or even another from Galderma is another one topical you can apply. As I said, is very important to apply 1 hour before, and you apply gently a coat, a very thin coat of the topical. Then we have a second application after 30 minutes more or less, and you can treat because the skin is getting number and number as the time goes on. So after 1 hour, you can treat with a very modest discomfort of the patient.
We are receiving really a lot of questions. At this moment, there are roughly 50 to 60 questions. So as the time is running up, so we will select just a few ones, and then Professor Bonan will reply to all the others directly to each of you, utilizing the email address that you've been giving to the moment of subscription. Let's move topic a little bit just to cover other practices. What's your experience, for example, in the treatment of painful plantar warts with CO2?
The warts, of course, are more or less painful depending on the area. The plant of the feet, for example, are very sensitive. So I think that we need the intralesional anesthesia or local regional. But better to block the entire area for the feet, for example, the plantar warts. For the this is for the warts in the plantar or the palmar warts, but for example, in the flat warts of the face, I prefer to use a topical. With a topical, you can use HP pulse. And for example, if you have HP pulse, you can use topical, wait for 1 hour, repeat a second application after 30 minutes, and use HP pulse, 7-inch spot size, and 10 hertz. In this way, there is not discomfort of the patient in the treatment. Otherwise, if you have very deep warts, you need all local regional or intraregional anesthesia.
Do you have a special recommendation for the treatment of melasma with the CO2?
This is normally the last question, but is the more critical question. I think that in this case, like in keloids, the approach is a multifaceted approach. So the fractional can play an important role, a crucial role in the treatment, in the procedure, and in the protocol must be combined with other laser and products. In our protocols, for example, we start to treat melasma with some vascular laser. Synchrovascu Deka is a great platform with the pulse dye, and even the Synchro Replay emitting Nd:YAG laser, or the new Luxea or the Motus capable to emit the Nd:YAG. For the vascular component, especially in the Asian country, the vascular component in melasma is predominant, is very important. So a vascular laser as a in one of the phase could be a very crucial. After the treatment with the vascular laser, we wait for 1 month, and then we perform 3-4 treatment with the fractional. But with the fractional, we need to adopt some particular protocols and some particular parameters. I always use HP pulse because it's a cold pulse. We must avoid to be too warm, too heated in the tissue. So we use HP pulse. We enlarge the space up to 1000 micron, and I use stack 2 or stack 1. And in this case, I prefer to use the fractional like a sort of drug delivery system, where I can gently spread and a quart of tranexamic acid that is well known at this point. Maybe all of you know this. You can spread the tranexamic acid cream over the top of the fractional area. So we can exploit the channels of the fractional CO2 to shuttle, to deliver, and to convey and to channel the substance into the depth. And so we have a good results. In the post-op treatment, we use hydroquinone as a first corticosteroids as usual for the 3-4 days, and then hydroquinone at least for 1 week.
Other questions are mostly related to keloids, and a few of the audience is asking about the settings for keloids, and together with it, what other non-surgical treatment should be combined with fractional CO2 when removed keloid scarrings.
Yeah, the fractional CO2 for treating keloids could be helpful in the case of not so giant keloids or tortoise keloids, because otherwise it's not enough. There is not efficacy of the fractional CO2 alone. So when we have a modest keloids, modest elevated keloids, we can try to use fractional alone. If you have a vascular laser, it's better to combine with this, as I said before, with an interval between the applications. And you can try to use the triamcinolone acetonide like a drug delivery system, using the fraction like a drug delivery system in the thinner keloids. In the other cases, we use to cut the keloids with the CO2 HP mode and the elevated keloid, and then we follow the recovery time, and in the recovery time during the wound healing. So we use the Botox just in the contiguous area in the follow-up, and then we use to treat with the pulse dye laser during the wound healing. So we need a multifaceted approach in the keloids.
Now we shift roughly to the spacing in between the dots while lasing. Are there many cases in which you might reduce the spacing below 500 microns?
I don't remember to have reduced the spacing under the 5, but there is only one case where sometimes I have reduced the space, that is the combination treatment for hypertrophy scars. I reduce sometimes in hypertrophies to 400 combined with a vascular laser in the strategy. But it's very rare to reduce the dot spacing. I think the ideal dot spacing, even from physical point of view or laser tissue interaction point of view, is 5. 5 is perfect, in my opinion, and of course, it's based on our experience.
Another case again. Do you have any special recommendation for syringomas and what we would do to avoid recurrency?
About what? Sorry, Simone?
Syringoma.
Syringoma. Yeah, syringoma is apparently very simple, very superficial. It's not superficial, as you know, is a tumor or is a benign tumor of the glands, and they are characterized by to go into the depth. So my tip is to use the free hand. If possible, if you have HP pulse, use HP pulse, 7-inch spot size, and microablate each syringomas. Pay attention to the endpoint. You have to go into the depth, but you must be very sure because you can ensure the good clinical results from cosmetical point of view. We have treated a lot of patients with syringoma, even multiple syringomas, and you have to treat as soon as possible because the syringoma spread a lot in numbers and even in size. So this is my recommendation: freehand, and use, of course, in the proper way. That's why I said that it's important to hold in the right way, because I didn't do it in the past, but not with the same results.
Some of the other questions we are still continuing to receive, so thank you everyone for this continuous flow of questions, are also relating the old Smartxide dot and the sets of parameters when using these kind of laser in the case of wrinkles and deep wrinkles.
Yeah. Thank you for the question, because I can answer by saying that the fractional, of course, is the strategy, and the fractional CO2. We have in the old Smartxide dot only SP. With the new Smartxide, square, punto, touch, and tetra, we would use DP, but even SP is important. SP pulse. For the wrinkles, we use a very important dual time. I normally go up to 1,200, 1,300 to tight the skin, because we need to tight with the heating of the tissue. And this is in terms of dual time, so we are around 1,200 and 300. And about the power with a Smartxide dot, the previous we stay around 12, 15 power. And I remember, even in this case, a combination with the freehand, because you can, as we do in the acne scars, where we vaporize the edges of scars. In the case of wrinkles, especially in the coarse wrinkles, we vaporize the shoulder of the wrinkles while fractioning the skin. So in the same session, we pass with the fractional, but in the same session, we use the freehand for vaporizing the shoulder of the wrinkle, so that at the end, we have a very uniform results, very satisfying results.
In the same track of the tricks, when we're using the CO2, how can we avoid the stamping post-fractional CO2 laser?
The pixel image, you mean?
Exactly, the square, demarcation lines after the fractional CO2.
Well, when we had the previous Smartxide dot, we got a lot of these pixel images that remain for a long time. But I noticed that actually we have at the end the improvement of the pixel images. So for avoiding this, it's better to be not so thermal in the tissue. So one could imagine that the ablation is important. It's not ablation. Is the pixel image is due to the thermal diffusion in the. So we must be in the average in the range that I suggested before for avoiding the pixel that is a long lasting pixel image. For eliminating the demarcation line, you can reduce the parameters in the limits in the border of the treated area, and so you can treat in a randomized manner the contiguous areas. Is one of the tricks that you can apply. We do this. If we have a spray mode, we don't have any problem, of course, that we have with Punto and with Tetra.
Do you have any indications on how long after isotretinoin is stopped can we do the CO2 fractional laser?
1 month before.
Good. A few of the questions we receive are mostly related to practical aspects, and particularly what we might adopt together and along with the CO2 in a future practice to be ready to start.
Well, first of all, I warmly suggest to attend our courses because we share the practical part, very simple maneuvers, so very the movements, how to hold the NPs, because it can make the difference. I noticed that if I had it in the past when I was younger, a sort of master that leaded me or teached me, maybe a lot of mistakes I've done, I would avoid in the past. So first of all, we try to share for the most part of our experience in the courses that Deka has scheduled in the past up to the, unfortunately, the lockdown due to the virus. And I think that starting from the basics of the parameters to the confidence with the machine, to know the physics and the basics of our strategies. So it's very important because I've known a lot of, I've met a lot of colleagues that they don't know anything about the parameters. So it's very important to know your platform like to know your wife, maybe better than knowing your wife.
Thank you, Professor. Another interesting question, in joining body shape device such as Onda with CO2 flow for flacidity. The question is, can we do the treatment in the same session?
Well, we are done in one case just to evaluate the discomfort sensation of the patient. But he had no sense because to do unless you are obliged from logistical point of view. But if you can please use an interval between the two applications. So first Onda, because Onda needs 2 months to metabolize the fat that we remove in the stubborn fat that in the subcutaneous tissue. Maybe you can even wait 10 days, not in the same session, because any kind of unwanted effect, we don't know then which is responsible for this. So my suggestion is to use Onda before, wait 10 days, for example, and treat with the CO2, because our targets are different or only partially overlapping. Because with Onda, our target is the fat, and we recall back the heating from the depth, and we can tight the skin in a sort of upside down thermal injury because we recall back the energy and we tight the skin. But it's better to not to overlap the two procedure because the CO2 tight the skin and get the firm skin from outside. So the risk to overlap too much and we don't see exactly what are doing in our protocols.
Any special recommendation for possible use of CO2 in darker skin type patient having acne scars?
Yeah, the suggestion is the same. The tips are the same that I suggest to avoid the PAH. You should use actually for the most part of the treatment, the HP pulse, if you have, because can make the difference in this case between the first and the prior ones. And with the H pulse, we reduce the risk in dark skin type. I suggest not to use 500 space, but to use 800, 1000, 800 and as an average spacing. So in terms of microns, and instead of power, reduce 2 points. If you use, for example, 10, it's better to use 8. If you use 8, it's better to use 6. And the stack could be crucial, but in this case, I always use 2 even in the darker skin type. And the post-treatment care is important. So in the darker skin type, I always use corticosteroids after the procedure. In the post-op, I continue to apply a thin coat of the clobetasol for at least 4 or 5 days.
There's a few questions relating to the striae, grayish, whitish striae, and how to deal with them using a CO2 laser.
I think that with the stretch marks, we have had a lot of great success in this kind of indication because we must consider the striae like scars, atrophic scars. So we stimulate, as we demonstrated in our studies and even in other studies in the literature, that with the fractional CO2, we can change the tissue component in terms of elastic fibers and collagen fibers. And so we pass from the old fibers to the new one. Of course, you need to treat a lot of times. It's not enough one, an average of 3-4 sessions. And it's interesting how to cover the stretch marks. It's better to stay a little bit out of the stretch marks of 0.5, one side and the other side, in your square area, square line. So stay just a little bit over the size of the stretch marks, and then you carry on treating as I showed in the video previously.
So before we end the session, one last question on the lip wrinkles, parameters and technique to deal with it.
Yeah, I repeat because we have to focus on the great capability to manage the different protocols. In the case of wrinkles, even fine lines, but of course, above all, the quartz and deep wrinkles, we need to be very, very aggressive in terms of heating. So I use not less of 1000 microseconds dwell time. This is the crucial parameters for the wrinkles. And so 1000, of course, we have to take into attention the color of the skin. But normally I'm around at 1000 dwell time. And then I use the 8 or 10 watt as a power, stack 2, and the space is not more or less of 500. This is very important. And remember, take in your mind to use as much as possible the freehand, the surgical and piece. So you are the protagonist again of your procedure. Combine, please, the two ones, and you will get fantastic results.
So, excellent job, Professor Bonan. Let me thank you and really tells how we appreciate your accurate, precise job in detailing to all of us the tips and tricks in using CO2 laser in our day-by-day practice. The webinar is actually closing right here. Thanks everyone for all the attention, all of your participation, and actually the many questions they are keeping on arriving here. Send them over, and Professor Bonanen and the team will reply to each of them. So thanks so much. Stay tuned with Deka webinars to the next one for the clinic application Focus AX, AY, and the newest Movio PL handpiece for the treatment of pigmented lesions. So thank you very much again for your participation.
And let me thank all the participants for your time, and let me say goodbye to the friends all over the world that I have in doctors, colleagues, and distributors. I hope that I will see you again in our webinar, and hopefully even in the future with the physically, where the empathy is important. So thanks for having me today and having you today in this webinar. See you soon.
Thank you. Goodbye.